Big Pharma is here to push on everybody, and this isn't new. And yes, I'm going to go toe to toe with Big Pharma, right? Because what they're doing, and this isn't new, what they're trying to do is they're trying to capitalize on this epidemic, this stuff that's going on. So everybody has seen this explosion of these injectable prescription and synthetic drugs, but actually prescribed by doctors, right, to the tune of anywhere from $1,200 to $4,000 a month. And here's what we're going to talk about tonight, Cameron and everybody else. We're going to talk about what these synthetic drugs are doing and how we are going to combat it. But here's what basically you see. This is really an interesting slash scary information for those of you who know anybody who has tried one of these semaglutides or these prescription and synthetic compounds. Here's what they're doing. And I'm going to explain this here tonight, and we're going to bring some doctors on to go deep dive on this. But what they're doing is they're flooding your body with a synthetic version of a hormone that would naturally tell you you're full. This is the GLP-1 hormone. Again, we're going to talk about this in depth. But here's the scary part. You're injecting this synthetic hormone or drug, and it keeps your brain thinking that you're not hungry for a continuous 168 hours. In other words, it makes you feel like you're full for a week. And the side effects, as you saw a little bit in that video, are kind of scary. We're going to talk about those tonight, right? So here's some of the really, again, scary things going on. And you guys can study this. Go study and do some keyword searches. Go search online semaglutides or some of these, brand names, and specifically ask for the side effects. I saw some very scary information a couple weeks ago, and that was this nausea. Cameron, I don't know, you've been nauseated before, right? That horribly nauseated, you want to throw up kind of feeling, got a headache usually. Nausea, right? Those of you who know what nausea is, I'm sure you understand what I'm saying. Up to 44% of the people that are injecting these synthetic drugs are having this primary side effect of nausea. Now, what's scary about that, besides the fact that you're having these negative side effects, besides nausea, you can see vomiting over time, muscle loss, fatigue. I mean, it's really bad. But I want to point out this, and I'm not laughing because it's not funny. But imagine what I just said. You're injecting a synthetic drug to make you feel full for a week, 168 hours. That means if you're one of the almost half of the people that the side effect is nausea, that means you're nauseated for a week and you can't turn it off. When you put in these synthetic drugs into your body,
Yes.
and your body is being told artificially, synthetically, I'm full
Right.
for 168 hours, day after day after day after day. What is the negative ramifications of that? Just that alone. Forget the fact that you're putting a synthetic drug in your body in the first place. But what is the negative side effects or, collateral damage, if you will, when your body's not eating for days at a time?
Well, when you stimulate the body like that, you actually start to drive an inflammatory process in the body, which is bad for us because inflammation, which most of you I'm sure don't know, is at the root of all disease. So we start driving diseases just because we want to lose weight by using a synthetic drug. There's a lot of different side effects, so it can cause a lot of organ breakdown. So that's where we see the pancreatitis coming in and so on. So it's just not what our bodies are used to. So driving our body into a situation where we're in quote unquote overdrive is just very bad for us. It stimulates our nervous system, which then could disrupt our entire organ system. It affects our brain, and all of this in a negative fashion. So I have a lot of patients who started taking these synthetic drugs, and I'm going to tell you about 95% of them have had to get off these drugs because they've had all kinds of negative side effects. So from uncontrollable nausea and vomiting to pancreatitis to liver issues and so on. So it's just not good to try to stimulate the body like that. We're replacing something rather than stimulating something. So we're really replacing what we need in our bodies to decrease our hunger and burn those so we have a caloric deficit. Too much of a caloric deficit can have negative ramifications, again, causing all kinds of issues. So it's better to stimulate the body, like with our product Curbix, to produce the things in our body rather than replace them and replace the function of those things that we naturally should be producing and move on from there and allow us to function normally. Part of the issue is that a lot of people are insulin resistant. Okay, so it allows us to gain weight and causes other issues. So it's helpful to do intermittent fasting. Intermittent fasting will work great. The product and intermittent fasting will work great together. But as Dr. Michael said, and we'll get back to, if you have gut issues, which most people who are insulin resistant do have gut issues with the gut biome, and we need to repair the gut in order to be able to get healthier and allow the product to work better.
Right. So thank you for that. Dr. Michael, we were originally a couple months ago when we started, formulating the content for the site because what we're doing is so unique, right? This is a totally unique, brand new technology, so to speak. But one of the big things we were talking about is the negative side effects is the muscle loss, right? We were talking about that when people aren't eating, their body is starting to buy, after they're kind of burning their fat, which is why they're losing some weight. They're also losing a bunch of muscle tissue. Can you explain that a little bit more detail?
Well, they're not getting the nutrition, the breakdown of the muscle, every organ system is because the nutrition of the body's not being nourished. It's an anorectic effect that these injections have. It's one of the issues with these injections. So, for example, heart tissue is breaking down. That was one of the big side effects of these injections is damage to the heart and all these other things that are caused by the lack of nutrients being received by the body. So, I mean, the food is just sitting there and it's not going anywhere and it's not being utilized, not being broken down. So no nutrition is being gained by the body. So the body is breaking down literally. It's been compromised.
Right. So think of it this way also to add to that. So in essence, the body begins to cannibalize itself. Okay. And then the food in the gut that we're not doing anything with because of those synthetics begins to rot and cause more damage to our gut, which leads to more disease, including autoimmune disease.
Okay, last thing, both of you as doctors with experience with people using these synthetics, can you help share with what happens when people stop using it after they've used it and lost weight? What's the next thing that starts happening?
Well, first of all, I have a lot of patients, as Dr. Stephen has, who are taking these injections. And the majority of them that stop this, what they find out immediately, they get ravenous. They start eating and they can't stop eating. There's stories of people eating amazing amounts of food within the first 3 or 4 days. So they're going to gain the weight back. And if they don't already have the effects of the side effects of this, which is unusual for them not to have experienced any side effects. But most immediate reaction I've been hearing and reading about is the regaining the weight. And with our product, what's interesting, if a person is using the injections, they can take our product and that will help them ease off the injections. And so when they do get off the injections, they won't have that won't happen to them, the ravenous or the start to get an uncontrollable appetite return. So this is a great issue. So if you have someone out there, you're telling them about Curbex, even if they're doing the injections, it would be a good idea for them to start taking the Curbex,
Right.
because sooner or later they're going to get off the injections. I mean, I've been reading that in March, the compounding pharmacies are going to be stopping to make the compounding of the compounded injections due to the pharmaceutical companies that make these medications, these drugs, want to do their own injections. So that as they then will get off of their injections, there'll be a shortage, if you will, soon to be in March of the semaglutide especially, so they can start on our Curbex to be able to get off the injections more easily.
Yeah.
Awesome.
And to add to the weight loss, I mean, we all call it rebound, but the weight loss that we get back is actually even more unhealthy for us than the weight that we lost, because we can gain a lot of visceral fat, and visceral fat is very dangerous for us.